Annual exams are one of the best ways to diagnose problems before symptoms occur. In addition to increasing your awareness about your overall health, yearly exams help identify signs of developing illnesses, and early detection is often the key to good health.
Establishing a relationship with a regular physician for regular annual exams is extremely important in terms of your preventive health. Having a record with a doctor will allow him or her to screen and know what your health has been and how it's changed. Annual exams, particularly at age-determined time points that are critical, such as 35, 40, 45, and 50, are extremely important in helping detect cancers and other diseases which can be asymptomatic. So having a record, having regular checkups is extremely important in your health, both prevention and ultimate cure if a disease does occur.
For men, prostate cancer is the most commonly diagnosed cancer in America and the second leading cause of death after lung cancer. There are three major risk factors for developing prostate cancer. Age. After the age of 50, your chances of getting prostate cancer increase greatly. Family history, which accounts for 10% of all prostate cancer. And race. African American men have a higher incidence of prostate cancer. After the age of 50, it is highly recommended that men have a yearly exam, since most men do not experience any symptoms in the early stages of prostate cancer. Regular screening is critical for early detection. Fortunately, a simple, inexpensive blood test called a PSA is now one of the most accurate ways to screen for prostate cancer. This test helps your physician obtain specific diagnostic information, so the diagnosis can be made at a much earlier age than ever before. Men over the age of 50 also need to be concerned with colon cancer, especially if it's present in their family history. A colonoscopy, when recommended by a physician due to family history, is very important for the early detection of colorectal cancer. The colonoscopy not only remains the most sensitive test for detection of colorectal polyps, but studies have shown that a colonoscopy also prevents about 80% of colorectal cancers from developing by removing precancerous polyps. For women, there are three age-determining exams that are highly recommended. They are the mammogram, Pap test, and pelvic exam. The National Cancer Institute recommends that women 40 years of age or older receive a screening mammography every 1 to 2 years. Women who are at higher than average risk of breast cancer should talk with their healthcare providers about whether to have mammograms before age 40 and how often to have them. A mammogram is quite simply an X-ray test that is used in early detection of breast cancer. Although patients do feel firm pressure, there is no significant pain involved in this scan. Mammography greatly increases the chances for early detection and the successful treatment of breast cancer. A Pap test, or Pap smear, and a pelvic exam are important tests for finding precancerous and cancerous cells in the cervix and vagina and other disorders. From the ages of 21 to 30 years old, women should have this test every year. When they have had 3 normal tests in a row, they can be screened every 2 to 3 years. Women that have had abnormal test results or fall into a variety of risk factors will need to consult their physician directly for suggested test lengths. The Pap test is one of the important developments in women's health care. Since its inception, there has been a dramatic decline in deaths from cervical cancer.